Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to the COVID-19 news conference for the latest in information for the community. Let me go ahead and briefly introduce who's on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Todd Bell, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. I'll go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm well, thank you, Dave. I'm excited to announce that just about 20 minutes ago, the governor's office released a press statement making an announcement that Texas Department of Emergency Services, the state, and the City of Amarillo will be partnering to open an infusion clinic here in the city to treat COVID patients. Back in August, as we saw an increase in cases, our hospitals obviously were communicating with city officials that demand for hospital services and an increase in COVID in our community was driving cases into our hospital and filling our hospital beds and taking up our hospital staff. That increased demand in response to COVID cases also created an increase in demand for COVID infusions for people who were either first diagnosed or maybe even just high-risk folks who had been exposed to COVID. And that was all happening about the same time that school was starting. We were worried about even further spread. And so our hospitals identified that we needed a way to increase both the amount of people that were able to access infusions in hopes that that would decrease the number of people who would need hospitalization because of COVID. We partnered with our school districts. So both Northwest, our leaders at Texas Tech Medical System, and also BSA were asking for help, and driving ideas around this infusion clinic. We had a community leaders meeting that included the school districts and those hospital and medical leaders, River Road, Bushland, Highland Park, Canyon, Amarillo Independent School District. All of those leaders were involved in saying, let us know how to increase the messaging out to our parents. And so just the partnership among community leaders here in Amarillo to better message that infusions are a good treatment and try to increase the number of people that would want an infusion in that situation that they were exposed or first diagnosed with COVID has really led to needing this infusion clinic and the success of it. So then the partnerships went outside the city limits as we began to partner with DSHS, TDEM. The governor's office is very interested in this project, and even city leadership inside our city departments. We had to figure out a place to put it, and our facilities team really stepped up and did an amazing job to create that space just in a couple of weeks. The public health department staff continues to exceed our expectations. They just step up whatever the situation is, and this has certainly been another time that public health staff has stepped up to partner and produce something that will keep more people in our community safe and healthy. But it also adds to reducing the stress on our nurses and our doctors in our currently full hospital situation. So I just want to say how proud I am of the partnerships that have gone behind putting this infusion clinic into place. With more details on the clinic, though, I'm going to hand it over right now to Casey Stoughton, our Director of Public Health. Casey?
I appreciate that. All of this is kind of coming together right now. In fact, we're, texting the team and making sure all the pieces are in place. So I certainly don't want to look distracted, but we're making it happen right now. So it's certainly a bittersweet moment. We don't want to need this clinic, but we do. And so we're thankful for all of the partners and to be able to have this infusion center. So TDEM and DSHS and the governor's office, we're thankful for their support and partnership in bringing the vendors and and the staff and the nurses here to be able to provide this. We will go live with the infusion center tomorrow. So Thursday, September 23rd, we will open the infusion center by physician referral. So very similar to last time, patients will need a physician referral. So Amarillo Public Health, in fact, that was the text I was sending out. I was like, asking our staff to go ahead and send out the health advisory to our local physicians so that they'll have the instructions on how to refer patients. So it's by physician referral. Patients will need to meet certain high-risk criteria, and will need that physician referral to be screened and directed to the infusion center. Patients without a primary care physician, we still want them to be able to be served too. So Amarillo Public Health will be standing up a call center. So at 378-6300, I hope you have that phone number memorized. But that phone number will be where we have a call center so patients can be screened and referred into the infusion center. There's some criteria that has to be met. So again, you have to have some of that high risk criteria. You have to have a positive COVID test and be within 10 days of symptom onset. You also cannot be on oxygen due to COVID-19 or hospitalized due to COVID-19. You can't have like a required oxygen need if you use oxygen daily for like a chronic healthcare condition. So those are some of the requirements for the infusion center. Our staff are sending out the health advisory now to local physicians, so they should have that information shortly. The infusion center will be located at 808 South Johnson, and that's right next door to the testing site. So that's hopefully a convenient location, or at least a location that you're familiar with here in Amarillo. I also want to say a special thank you to our team at facilities led by Jerry Danforth. They rehabbed that facility in very short order, just a couple of weeks. And so they made it just where it's going to be a great space for our team to use. Both Northwest and BSA have just been great partners, making sure that we know what they need and that we all can work together, making sure we have medication for patients, that we are able to take care of our community. So I appreciate Dr. Weiss and Dr. Lamentier. Just this team has been truly outstanding. I also want to thank our communications team and Amarillo Public Health. Our staff are just, like, we do a lot with duct tape and baling wire, but this is truly an outstanding facility. So I hope you don't need it, but if you do, it's going to be really great. So we'll talk about the numbers real quick as well. As of yesterday, there were 44,198 cases of COVID-19 in Potter and Randall counties. We're currently at 4,335 cases, active cases, and we have 871 deaths here in our community since the beginning of the pandemic. The 5-day new case average is at 218 new cases per day, and we're currently in level red. Yesterday, our GA34 hospitalization percentage was at 16.3%, and we do remain an area of high hospitalization as well as an area of high transmission. The 7-day rolling positivity rate is at 12%, and the positivity rate at the drive-through testing site is at 34%. COVID testing is still available at 378-6300. You can be screened and directed to the test site. Like I said, it's downtown. That address is 801 South Lincoln, right there just kind of east of the Hodgetown area. We have COVID vaccinations available at many locations here in our community, certainly at the Public Health Department. We're currently offering those at 850 Martin Road, and that's a walk-in clinic. We also have some additional clinical services available. STD testing, TB testing, and our regular immunization services are available by appointment at 378-6300. That's all I have, Dave. Thanks.
Thank you, Casey. Let's now go to Dr. Todd Bell, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Bell, how are you?
Doing well. Thank you, Dave. Appreciate the opportunity to be here. First of all, I'd like to just continue on the theme of the infusions for a little bit more. I want to just sort of point out that the infusions that have already been given over the past 2 months have really been the difference, I think, in preventing us from overwhelming the hospital system. those infusions, if those patients who've received those infusions had ended up in the hospital, I think that might have pushed us over the edge. So I would encourage people that if they're in a risk category, that if they have a positive test, they're in a risk category that would benefit from the infusion, talk to your doctor about it, locate one of these places. And again, with the new infusion center starting, that should make that even easier. And again, just do appreciate the hospitals and their hard work on providing those infusions over the past few months. The second point I'd like to make is about booster shots. There's been a lot of discussion about boosters. As a reminder, first of all, for those folks who are immunocompromised, either because of a disease state or because of a medication that they take, they should get their third dose of the mRNA vaccine, whether that be the Moderna or the Pfizer. We know that those third doses are going to be really helpful in being able for them to achieve that. Now, there's been a lot in the news about boosters in other age groups and other demographics. And right now, that still remains a little bit of a question. The meetings are still going on amongst actually at the CDC today about what recommendations might be made. We're waiting for formal recommendations, and we anticipate that in the near future, we'll have formal recommendations about some subset of the population that would potentially benefit from booster injections. And so I just want people to be aware that we don't have that information yet, but when we do, we'll certainly make sure that it becomes available to folks and that those booster shots are available as well for those people that qualify. The final point that I would just like to bring up is that even though we have really positive things happening from the standpoint of maybe booster shots for some people in the near horizon, the fact that we have the infusion centers going on, the basics of this pandemic really have not changed, which is that we are still in a high transmission area. And at this point, we still need people to, if they're unvaccinated, to become vaccinated. That's probably the single most important thing that we can be doing. People to wear masks when they're in crowded indoor situations or public settings. Good hand hygiene, social distancing, those same things that we've been saying for the past 20 months are things that we are going to continue to be important for the foreseeable future. And so I would encourage us as a community to continue to step up and do those right things, help protect ourselves and help protect our others, our friends and neighbors in the community. Thank you, David.
Thank you, Dr. Bell. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
So Dave, I have to say today I'm a bit numb. This afternoon, we're going to say goodbye to a gentleman that was a beloved member of the Northwest family. He was also a vital team member for Lifestar, and he was a long-time colleague for many first responders in the Panhandle of Texas. And he took his life last week. Now, you'll hear lots of talk about COVID, but I want to remind people that September is Suicide Awareness Month. Right now, there are 1,900 people dying every day in the United States from COVID-19. There's 132 people who die from suicide in the United States every day. The difference is COVID's going to go away, but we have seen a 35% increase in suicide rates since 1999. And certainly, Dr. Gonzalez has mentioned the concern with he and his veteran colleagues about this problem. You know, so I think our plea for COVID-19. Please get your vaccines. Please wear your masks. Please keep your distance. But in the honor of my friend, I want to make another plea today: is please take care of your mental health and the mental health of those you love. COVID-19 has caused a lot of significant problems for people, and mental health has been a serious concern. There are plenty of resources in this community to get yourself help, including the behavioral health facility in Northwest. Hey, but please, if we can avoid the absolute devastation that occurs when someone takes their own life to their family and friends, we need to do that. So I'll move on to our numbers at Northwest. So we have 57 positives in the hospital today. 53 of those are people who have not received the vaccine. Now, interesting, 4 of those are young ladies who are expecting on our L&D ward. And please remember, the vaccine is highly recommended for women who are expecting, who are pregnant, to avoid the complications this virus can cause in pregnancy. Now, so 11.5% of our licensed beds are going to COVID-19 patients, but actually 21% of the patients that we have in our acute hospital are the COVID-19 patients. We have had about 55 to 65 per day over the last 3 to 4 weeks. So we're not getting worse, but we're not necessarily getting better. We're just kind of hovering in that same range. Right now, we have 27 COVID-19 patients in our ICU. 7 of them are on ventilators. Now, earlier this week, we had a real scare. We were down to 1 ventilator left in our hospital for patients. Now, we've gotten out of that situation, but that's because we've had people succumb to the virus. We have had 26 deaths for COVID-19 in September at Northwest. That's much higher than we've seen over the last number of months, and that's very concerning. Now, with regard to our outpatient testing, we saw an 8% positivity rate yesterday. I'd say over the last 2 to 3 weeks, we've been between 15 and 20% positives. Over the last week, we've been more like 8 to 12%. I'm hoping that is a good sign that maybe we're seeing some decline of the presence of the virus in this community. We talked about our staffing problems, and we have certainly benefited from the help of some of the visiting nurses coming through FEMA and the RAC. We had 11 patients holding our emergency room this morning waiting for beds. Right? And we know that there were 20 out in the region waiting for beds to be moved to a higher level of care. And out of those 20, 14 were ICU patients and 9 of them had COVID. So we're still not quite able to serve our regional facilities and partners by bringing these patients in the way we need to. And we have 27 staff members quarantined today at Northwest. Medication-wise, we continue to give dexamethasone, remdesivir, baricitinib, all to these patients if we can to try to save them from the ravages of this virus. And as we talked about, Regeneron has been a very positive experience in terms of the outpatient infusions, and we greatly appreciate the help of the city and the Amarillo Public Health Department and now the state to provide this clinic where we can really make sure that people are getting the Regeneron that need it. You know, over the last couple of weeks, I've tested a number of people myself who have had the vaccine that are testing positive for the virus. But what I see is most of these people feel bad for 2 to 3 days and then get over it. They have mild to moderate symptoms and then just get past it. We know these vaccines are safe. We know they're protective. Okay? If you just look at our hospital numbers, the vast majority of people who are suffering terribly from the COVID-19 are those that have not been protected by the vaccine. So again, I ask you to get your vaccines. And as I stated earlier, please look out for your mental health. Please recognize Suicide Awareness Month in September and take care of yourselves in that way. That's all I have. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Good morning. Thank you for letting me join this morning. I'll start off today with thanking Dr. Weiss for mentioning Suicide Awareness Month. It is a significant problem. I think we all have examples of either with family or friends or certainly coworkers where we can recount examples where we unfortunately lost someone who potentially could have been helped if we knew that they were suffering and were able to get them proper counseling services and or medical therapy to combat their depression, which is oftentimes the source of what leads to a suicide, unfortunately. As far as we are set today in terms of COVID-19, we have 71 patients in the hospital today. We've been hovering in that 70 to 80 range here for a while now, similar to what Dr. Weiss mentioned at Northwest. We are really not getting better. We're not getting worse, just kind of stabilizing in that range, which is a lot of patients that are hospitalized still with COVID-19. And I think what Dr. Bell said earlier is a key piece, which is without the monoclonal antibody infusions that we've done at a high number in our city, in our region, we would be in a much different situation right now in terms of the strain on our hospital systems. Of the 71 patients that we have in the hospital, 38 are in the ICU. Of those 38 in the ICU, 18 of them are on the mechanical ventilator. Our biggest issue has been really the staffing issues that continue to be an area where we get nervous about having limited ICU capacity. It's not the physical beds, it's not the equipment. Typically, it is the ability to have nurse staffing and taking care of that many ICU patients. Fortunately, we have nursing support from the government, the state and federal government, and that is right now we had, as of yesterday, 51 RAC nurses here. We also have employed, and I shouldn't say employed, we've hired contract nurses in addition to our set employed nursing staff. And as of yesterday, we had 48 contract nurses that BSA hired to be on site to help also support our core nursing staff, who is working tirelessly to manage all kinds of patients with significant disease, COVID being only one of them. It just happens to be a very significant part of our hospital capacity right now. We have 325 patients in the hospital today at BSA. That's a high census for us. 22% of that total census is secondary to COVID-19. 71 out of that 325. We're continuing to see fair numbers of patients coming through our respiratory triage unit and our ER. That is patients that are having respiratory symptoms, which could be COVID-19, could be the flu, could be RSV or other illnesses, bacterial pneumonia, for example. But certainly we have to handle those initially like presumptive COVID because of the current frequency of disease in our community. Of our employed folks, 19 right now are quarantined because of either infection or exposure. And again, some of the quarantined individuals have been vaccinated. Fortunately, when they are, as Dr. Weiss mentioned, when they are vaccinated and they get infected, they tend to have very mild symptoms. None of those employees that have been vaccinated and infected with a breakthrough infection have required hospitalization, which is, I think, an outstanding statistic, meaning that they're not getting severe disease. Overall of the 71, 87% of the patients in our hospital today, 87% of those that have COVID-19 are not vaccinated. Again, that has held true. It has held steady. I know that we're putting out a weekly report that shows the entire Amarillo medical community in terms of hospitalized patients, how many are hospitalized that are vaccinated versus unvaccinated, how many that are in the intensive care unit that are vaccinated versus not, and how many deaths we're seeing vaccinated versus not. And the folks that are doing better across the board in all those areas are the people that are vaccinated. So again, it is a situation where we know the vaccines work. We know that the boosters are important, especially now for the immunocompromised. And I can tell you that many of our employees and many of our physicians on our medical staff are very anxious and awaiting approval of the booster shot for healthcare workers. And I'm one of them, meaning I think it's critical that we're looking at giving boosters to people that are at higher risk. And certainly once that's approved, that healthcare workers can be set up for that booster. I'll be also getting in line behind my folks that are on the front lines that are putting themselves at risk every day. And the reason for that, I'm saying that is because I think it's critical that we understand that the data has been very supportive of the efficacy of these vaccines. There are many things we do in medicine that haven't had this data that's been as reassuring, if you will, that we utilize on a day-to-day basis. You would be amazed. So it's a little bit of a concern when we have folks that are questioning the efficacy. We realize it's an independent decision of whether you want to get vaccinated or not. But once you look at the data and spend some time examining that, it's pretty obvious that these vaccines are safe and they're effective. And I'll also echo what Dr. Weiss said about women who are expecting, pregnant mothers. Please strongly consider getting vaccinated. Not getting vaccinated and the potential of COVID complications during pregnancy and also the postpartum period certainly are very concerning. And I've heard a lot of things coming from different avenues about why either expectant mothers or those who are attempting to get pregnant are avoiding the vaccine. And none of those make sense to me when I hear those rationales about why they wouldn't want to get vaccinated. So please reconsider. We're concerned about your safety. A couple other statistics to really just tout here are the following. 47% of the patients we have hospitalized at BSA today with COVID-19 are less than age 60. 23% are less than age 50. We have one pediatric patient currently hospitalized as well now with COVID-19. Of all of the ICU patients that we have with COVID-19, 94% are not vaccinated. As far as therapies, same as Northwest, the primary therapies, if you're admitted, continue to be steroids, and remdesivir, obviously supportive care with oxygen and those therapeutics that have been shown to be effective. Number one. Number two, in the outpatient setting, we are being very vigorous with Regeneron infusions. For the month of August, we did 466 Regeneron infusions, and primarily through our BSA Urgent Care Center. That team has done an outstanding job there of infusing patients, and I'm certain preventing many hospitalizations in the high-risk categories. And in September so far, through the first 13 days, this is as of last Monday, we had infused 263 additional patients. So again, we continue to do so. Drug inventory is really the issue now for all of us in terms of some of the restricted allocation. We are going to do whatever we can to support the city clinic so that we can see more patients getting infused more quickly and not have delays. So we are going to work with Casey and Dr. Bell and Dr. Weiss to make sure we're sharing that drug adequately. And they have shared drug with us generously to this point, which we're very appreciative of. The last thing I'll say is, and I'm going to say this because I think it's important to say it, and that is that we've had some patients come to our hospital and the families have demanded treatments that are not substantiated in the evidence for their loved ones. One of those is ivermectin. And I will say this today, and I'll repeat it again if needed, and that is that we will not be prescribing drugs that are not supported by the medical community in well-done trials for patients that are admitted. The CDC, the National Institutes of Health, the World Health Organization do not support prescribing drugs such as ivermectin for acute COVID because there's no good data that suggests it has any efficacy. It's no different than me saying I'm going to prescribe cinnamon to treat your COVID-19. So again, our physicians get very uncomfortable when patients demand therapies that are not proven. And the support we give our physicians when that comes across is simply to say that you're not mandated to prescribe anything that you know is not efficacious based on your training and your knowledge. We're going to continue to do what we can to save patients' lives. We've now saved over 3,000 COVID lives since the outset of the pandemic over a year ago. That's a running statistic, and we're doing so based on following the evidence and really encouraging our folks to continue to do so. That's all I have today. Thanks, David.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, Dave. Thank you. So I'll start right off with our numbers. Currently at the Amarillo VA, we have 7 COVID patients, 4 of which are in our ICU. You know, we've talked about vaccinations, and I do encourage everyone to get vaccinated. We continue to offer the Moderna vaccination here. And so I encourage all of our veterans to please get vaccinated if you have not gotten vaccinated yet. If you're eligible for a booster, such as those immunocompromised, as we spoke about earlier, we are able to give that booster also. So for all veterans who are immunocompromised, please talk to your provider, come on in, and so we can get you vaccinated. Speaking of vaccine, we also have the flu vaccine. So we are begin our flu vaccination drives. We are vaccinating our employees right now. But if you come into your appointment, you'll likely be offered your influenza vaccine. I had my own appointment 2 weeks ago, and they offered me my influenza vaccination. So I took it right then. And so encourage, to get that flu vaccine. Next month, we will be in our flu drives for our veterans at all of our sites. You know, it was mentioned, Dr. Weiss mentioned it about Suicide Prevention Month. You know, last week we had our teletown hall with veterans, had a couple thousand veterans where we talked about this important topic. And so I want to thank the veterans who participated to seeing what we can do more about preventing suicide amongst our veteran population and in general in our broader community. You know, this year, the VA has been using the term reach out, and that's important for veterans that have concerns to reach out for that help. There's things within the VA, there's things within our community to reach out, but also for us to reach out to those that we see that might be struggling. Sometimes it's just a little thing. You know, I've talked on here before about a driver who worked with me at Fort Leonard Wood who committed suicide. One day she was our driver, next day she didn't show up to work, found out she had committed suicide. You know, it is a tragic story, every loss. And, you know, I'm happy to report, and The VA just released something in 2019. Their 2019 data showed veteran suicides had gone down from 22 a day to 20 a day. That is still 20 too many a day. And Dr. Weiss repeated some of the earlier stats. Even one suicide is too many. And so just to encourage anybody who is needing assistance, if it's a veteran, please reach out to the VA. Anyone else, please reach out to the various community resources that are available for suicide prevention. And so with that, I just once again encourage everybody to get their flu vaccine, their COVID vaccine, and we're going to get this behind us. I do thank the city, BSA Northwest, for their infusion centers. We do have the infusion here at the VA. However, we've utilized those resources also, and so really appreciate the community coming together to take care of this COVID pandemic. And thank you, David. Appreciate the time.
Thank you, Dr. Gonzalez. We now go to members of our media who are in attendance. If you have a question for the panel or an individual panel member, that's completely fine. Let's go ahead and start with Dave Furtado of KVII Channel 7. Dave, how are you today?
Doing pretty good. How about you guys?
Good, thank you.
Good. Hey, I just have a couple of questions, mainly focused on the monoclonal antibody thing that you guys are doing. Now, first off, we're seeing that come here. Have we seen it improve? Have we seen improvements in those other state-sponsored clinics around the state? Have we seen that, and are we hoping for that improvement here as well? Oh, and that was geared more towards Casey. I should have prefaced that.
The state does have monoclonal antibodies. They've partnered with other communities around the state. I think there's, probably 18 or so. And so we're certainly, we know how effective the Regeneron is. And so we want to make sure that our community has the most access that it can to that resource. And so we're super thankful that we can partner in that way with the state and with our other community partners. So absolutely.
Okay. And a follow-up to that, I saw in the press release that you guys, this new facility will have treat up to 200 patients a day. How many was the public health able to do before that? Was it still around that 200 mark, or was it a little bit lower than that?
No, so we had an 8-bed unit before. So when we had an infusion center probably in the December, January, February timeframe. And please know that all of the months and weeks are running together right now. So that may not be exactly right, but in the winter of last year. And so we had an 8-bed unit at that time. This will be a 20-bed unit. And so we certainly have additional capacity. There's also been some changes to the way that medication is administered. So we will be able to administer a little more quickly than what we were last time. And so we'll be able to have a much larger capacity this time around.
Now, I know, some of the doctors were talking about how we're kind of stagnating a little bit or kind of reaching kind of a steady level with our hospitalizations. I am looking at the reported cases, kind of the trend for the whole year, and we can see quite a spike in going into October and November. Are you guys hoping that these new 20 beds, if you will, this upgrade into the monoclonal antibody situation, do you think that'll help kind of keep these levels on the lower end? We're already going into that time frame where we saw a significant spike last year. So are we hoping that this new 200 patients a day thing is going to kind of keep that lower?
So are you talking about new cases per day?
Yeah, so what I'm just looking at the trends from the last year, and we can see going into October and November, we start seeing those significant spikes. But all the hospitals folks are saying there's a little bit of a steady level happening. We're kind of steadying out. So are you guys hoping that these new 200 patients a day that you can do to the monoclonal antibodies, do you think that'll kind of help, stave off, if you will, that significant spike like we saw, in November of last year?
Yeah, I'll take a stab at that if you don't mind, Dave. So I think there's a lot of things that play into that. The epidemiology, when we looked at the spike back in November and December of last year, had a lot of different components to it. A lot of it had to do with social activities. A lot of it had to do with timing of when the virus was really introduced and reached a critical mass in our community. Some of it had to do with the timing of our earlier peak. And then the things that are different this year going into the fall, there's really three things that you got to think of. One of them is Delta is more contagious, but because it's more contagious, we also got hit earlier in the fall than we did last year. The second thing is that we have vaccines. Last year, we didn't have vaccines. That's a huge game changer. And then I think the third thing is the potential in those folks that are infected to be able to prevent hospitalization by the use of things like the infusions. With those three things in combination, we would anticipate, bearing in mind that nobody makes perfect predictions, but we would anticipate that our numbers are not going to be going up in November and December like what we saw last year. Last year's November-December peak is what we are likely experiencing right now. And again, I think it's good news that we haven't had such an increase in our hospitalization rate that we've overwhelmed the healthcare resources, although it is notable that we did require being able to pull in additional staffing to be able to meet the demand that we've seen so far. So it's too early to let our guard down. We want to keep making sure that we're vaccinated, that those folks who need the infusions get them. We want to wear our masks and all those things. But we hope that November and December are going to look a lot better this year than they did last year.
All I have for questions. Thank you so much for answering that, guys. Thanks.
Thank you, David. Let's now go to Michael Cavello of the Amarillo Globe News. Michael, how are you?
Doing really good this morning. Thank you. My question is sort of to the infusions. It says about 200 patients per day could be serviced like that. And I know it's a little early in the game to say this, but what impact do you think that will have on your ICU usage? I mean, have you kind of like statistically looked at what the impact you think it'll have, and that's to any of the providers?
I would take and again, just throw out initial thoughts here because I got a big mouth. The one way to think about this is that for every 20 patients that you treat with Regeneron, you've prevented one hospitalization. So for every 100 patients that you've treated, you've prevented 5 hospitalizations. Of those folks that are hospitalized, somewhere on the order of about 20% of them have to be put in the intensive care unit. So you can kind of do the math. It's not a one-to-one. You give a Regeneron and you prevent one person going into the hospital, but when we're treating these large numbers of folks with the Regeneron, that decreases the pressure on the hospital. And bearing in mind that when those patients go into the hospital, they don't turn around and come back out in 24 hours. They continue to require care and the bedding and staff for an extended period of time. And so it's the cumulative effect of these Regeneron infusions we think will be able to prevent us from overwhelming those hospital resources. I would certainly open it up to our hospital colleagues for additional comments.
I agree with Dr. Bell. I think that's exactly right. The only thing I would add in there is that when we did the studies, when the studies were done on the monoclonal antibodies originally, it was not with the Delta strain as the causative strain. And again, we know this is far more transmissible, far more virulent in terms of causing severe infection. So the question is that number needed to treat to prevent a hospitalization potentially lower? I would argue that is a possibility. Either way, what we aren't seeing is the following. People who have received Regeneron, who are infected, who have lots of risk factors, meaning high risk for a severe course, showing up in the hospital a week later and needing to be hospitalized. So again, more anecdotal experience going back to say, along with the evidence we already had beforehand in the trials, that the drug is working.
Thank you. I would just say too, Dr. Bell and Dr. Valentier talked about this number needed to treat. It sounds like, well, gosh, you have to treat 20 just to prevent one hospitalization. But remind you, in medicine, that's an incredible number. A lot of therapies we do, the number needed to treat is hundreds to get one beneficial effect. So this is actually a very productive intervention. And the thing is, just like last week, we got down to one ventilator left. Boy, preventing one hospitalization in one ICU makes a big difference. So this is a very effective intervention, and we really appreciate the city for setting this up for us.
Any other questions, Michael?
Yeah, I do have one question. There's a lot, and you brought up pregnant women getting the vaccine. There's a lot of information being put out, like misinformation, like people using VAERS reports to somehow substantiate problems with, something happening to babies. Is there something that can be done? And I know there is something that can be done, but is there a way to get the message out better to the community that there's no strict problem with getting vaccinated if you're pregnant? Because I see a lot of information out there that is still pushing out that babies are dying because their mother got vaccinated.
Michael, I would say I wish there was. Understandably, women are nervous about an intervention that could put the baby at risk. But particularly once you get past the first trimester, at that point the baby is almost fully formed and it's just growing after that. But I can tell you, our experience in Northwest is we have had to deliver several infants prematurely because their mothers were getting sick to the point of having to go to the ICU and be put on a ventilator. So we are seeing premature deliveries from the effects of the virus. And then we've had one young lady who delivered and has been in our ICU for well over a month on a ventilator, has never held her baby. So again, I think these vaccines are critical to prevent these complications in pregnancy.
Yeah, I would just second that. There is data now that COVID itself causes increased risk of stillbirth. There's some suggestion that COVID itself can cause issues with fertility in men than in women. We have good evidence that the vaccines don't do either of those. The vaccines are protective for women. I think that any reputable source that folks go to that actually looks at the data is going to tell them the same thing. And that, hey, this is a safe intervention. It's something that's important for pregnant women to have. Now, we're blessed to live in a free country, and people can say lots of different things. And to quote a relative of mine, you can't cure stupid. So people sometimes say stupid things, and especially they'll do that in social media. And unfortunately, that is something that we don't have a way to be able to stop or to block. That's one of the great things about living in the U.S. is I can say whatever I want. But we would totally, in any way possible, encourage people to try to go to reputable sources, find the primary data. Don't be depending on Facebook and whatever your favorite news outlet is to be your source of medical information. You got to get to a reputable source to get that good information.
Dr. Bell, I'm just going to interrupt for just a second because I'm really curious about what you would say to a pregnant mother. What is a reputable source?
So great question. Thank you for asking. So for a pregnant woman, there's a couple of places that I would potentially go. One of them is actually called ACOG. That's the American College of Obstetrics and Gynecology. It's the largest group of obstetricians and gynecologists in the United States. They are a very reputable and knowledgeable. These are the folks that set the standards and the guidelines for how we take care of pregnant women. So go to the ACOG webpage. They do actually, I believe, have an outpatient, a patient access that you can look through and be able to see what recommendations and kind of patient information. And they actually do have some information, I believe, about the vaccine itself. I think that going to the CDC is also a reputable source. These are the folks that have dealt with pandemics and infectious disease outbreaks for a long time. They're the leading source in the US. So the cdc.gov website is a good source to go to. You can go to, I don't know that we have on our local health department specific to pregnant women and vaccines, but we also have information about vaccines on our local Amarillo Public Health Department website that you can go to as well. I would also encourage people to talk with their doctor and encourage their doctor to go and look at the primary data and the primary sources. Again, I think that when people go and they look at the actual data, then they're going to come to the same conclusion that the American College of Obstetricians came to, which is that pregnant women needed to be vaccinated. And thank you for that reminder about reputable sources.
I said, Dr. Bell, I had one of my patients recently on the cdc.gov. There was a very nice one-page summary of the data for pregnant ladies first, second, third trimester, summarizing the data and final recommendations. It was an easy one-page printout I was able to give to this lady trying to encourage her to get that vaccine.
Any other questions, Michael?
I guess one more quick question is the Regeneron, do we have data for patients that have, like we have data for unvaccinated patients dying. Do we have data of Regeneron patients that have passed?
I don't believe so. Does anybody want to correct that? It's not something that's I don't believe that's a reportable data set point. I think that's a good question. It'd be great to know.
It's a good question. I agree with Dr. Bell. It'd be great to know nationally if we have those statistics. I can tell you that we're not seeing people that get monoclonal antibody therapies even showing up in the hospital. And if they do, they're not the ones getting the severe infection. So certainly it's possible that that's going to happen in small numbers just because of patient uniqueness, different immunosuppressing diseases or drugs that people are on. As we mentioned before, the people that are vaccinated who are succumbing to disease have either been vaccinated very recently where they haven't had a chance to build that response, antibody response that is, or they have such significant pre-existing conditions or are on such immunosuppressing therapies that, again, the likelihood of them having a bad outcome, regardless of the type of respiratory infection, whether it was flu or bacterial pneumonia or COVID, the likelihood of them having a bad outcome is going to be high either way.
Thank you, Dr. Lamentier. Any other questions, Michael?
That's all I have. Thank you very much for your time.
Thank you. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you?
Pretty good. How are y'all?
Good, thank you.
First question is, as far as the booster shots go, if you were vaccinated with the Moderna shot or the Pfizer shot, do you need to stick to that brand for the booster, or can you mix and match?
So great question. And again, the boosters so far, we're still waiting, thinking of the immunocompromised folks as being a different category. When we're talking about boosters for folks who are not immunocompromised, we currently don't have the recommendations on that. Again, those recommendations and meetings and things are happening right now. At a federal, the information that they're looking at is, to my understanding, all Pfizer related or in some other settings, Moderna related. There's not data that they're looking at mixing and matching right now. There is some older data from the UK back months ago that looked at matching or mixing different types of vaccines as part of the primary series. And there is actually some data that doing those mixing and matching may actually be a good approach. However, there's not the formalized data to be able to look at it from the standpoint of boosters. And so my guess is when the recommendation does come through, which it hasn't at this point, it'll be that those folks with Pfizer who had the vaccine more than 6 months ago and are in some particular category, whether that be over the age of 65, healthcare worker with continuous exposure or something like that, that they would get an additional dose of the Pfizer. But again, we don't have the recommendations yet, so it's hard to be able to completely comment.
All righty. And I'm asking this only because we have received a number of phone calls here recently. But if you've got the COVID-19 vaccine, do you still need a flu shot?
Yes, please. So very different very different viruses. We do know that not only are they different viruses, people can actually get COVID and the flu at the same time, and that actually has significantly worse outcomes than if they have either by itself. Getting the COVID vaccine will not protect against the flu, and getting the flu vaccine will not protect against COVID. It's using bug killer on a weed. It's the wrong kind of medicine for the particular virus. So people need to get their COVID shot. They also need to get their flu shot.
All righty. And sorry, lost my place in my notes. We're still hearing possibility of them expanding the vaccines to kids between 5 and 11. Have y'all heard anything about the timeline on that possibility?
So again, this is one of those that I hate this term, but it's a fluid situation, right? So the Pfizer put out some data that actually seemed to be very positive. They actually, the way that they approached it, my understanding is they actually reduced the total dose of the vaccine that they were giving, but they still were able to get really good results on the antibody testing that they did. So these studies have been going on for several months. And so they just released the study actually this week. That still has to go through the process of going to the FDA, being vetted through the FDA, then subsequently to CDC and the ACIP in order to be able to have a formal recommendation for that to be done. You'd probably be looking at about 6 weeks would be the earliest that we would have. 4 to 6 weeks would be the earliest that we would have a recommendation regarding vaccines in kids age 5 to 11. Anybody else have any comment on the timeline on that?
All righty, thank you. And real quick, Northwest, do y'all have a number off the top of your head of how many RAC and contract nurses you have right now?
No, I don't. I don't. I can get that to you. I think we're similar to BSA's numbers because we've been essentially splitting any of these nurses evenly coming to town. So, but I don't have exact numbers for you.
All righty, thank you. And Allie has a quick question.
Hi. So, as the pandemic continues, we're still reporting these numbers every day, but we want to keep reminding everyone that these are people. So whether it's a Northwest, BSA, anyone can answer. Please feel free to answer. Could you share some of the more personal stories from the people you've treated and their families?
I'd say, we due to confidentiality, we have to be very careful about talking about individual patients in that way. What I will tell you is, fortunately, I have had the opportunity of having several patients who spent a month or two in our hospital come back in the front door and walk in and look great. And again, those are the kind of folks we're trying to get our staffs to see, because I think so many times our ICU staff see the patients who either succumb and die and go to the morgue or go to a long-term acute care facility. Usually at times they have a tracheostomy and a feeding tube. And yet we do see people coming back who have survived and done well and got back to normal life. And that's reassuring. But for a lot of these folks, that's a long road to recovery. If you've been in the ICU for a month on a ventilator, you got a long way to go before you get back to feeling like yourself again.
Any other questions from KMR?
I think we're good. Thank you very much.
Thank you. Let's now go to, if I'm not mistaken, Kevin Welch of News Channel 10, KFDA. Kevin, how are you?
Hi, Dave. I'm good. How are you?
Good.
Good. Say, Dr. Gonzalez, can you give us a little summary about the staffing situation at the VA right now?
I'm not sure exactly what you're needing with the question. I mean, we have staff. Our staff are all internal. We have not brought any staff from outside the VA. We have sent a few staff members to help with hurricanes or things, but that's been small in number. But we have our staff. We do have a few staff out that are out due to COVID, like other hospitals, but not to a large degree.
Okay, that's good. Dr. Bell, been seeing some information about across the state of people, a large number of people skipping their second doses of vaccine. Is that an issue of concern here?
Yeah, it really is. So when we look at the efficacy of the vaccines, the efficacy, it's kind of like if you're making chocolate chip cookies. And you know they're great chocolate chip cookies. As long as you follow the recipe every time, you have a very predictable product. When you start making changes to the recipe, then it's hard to predict what the outcome is going to be. If I'm going to start substituting coconut oil for the butter in the chocolate chip cookies, it may turn out great, but it may not. I just don't know. So when folks start skipping the second dose on the vaccine, or we say, boy, you know, I had COVID, maybe one dose will be enough. I think that is, they're kind of playing with fire because they don't know if they're going to have a predictable positive result if they do that. So what we would encourage people to do is get your first vaccine and then get your second one. And so that you're following the recipe so that you can have a predictable level of immunity after you've done that. Now, there are certain situations, if someone has a severe anaphylactic reaction to the first vaccine, that's rare, but it does happen. If that happens, then talk with your doctor and work with your doctor in making the decision of should I get the second dose. But that's actually a really rare and uncommon event. You can tell if you've had an anaphylactic reaction because someone jabbed you with epinephrine in the vaccine suite and possibly put a tube in your throat to help you breathe. And so if that occurred, then again, talk with your doctor about whether the second dose is appropriate. In other situations, though, again, if you have a question, talk with your doctor. But for the most part, we need to follow the recipe.
Well, Casey, do you know if people in Amarillo are following the recipe? Are they getting their second doses?
I think for the most part they are, but we certainly have a percentage that that haven't come back for their second dose. So, like Dr. Bell said, we certainly encourage people to do that. There's lots of opportunity to do it. So, if it's convenience, then pharmacies have vaccine. Many doctors' offices have vaccine. We certainly want to make it as convenient as possible at the public health department. So we certainly encourage people to do so.
Okay. And can you update us on the status of vaccination rates?
I think we finally tipped the 40% mark. So I think last time I looked, Potter County was right around 43% and Randall County was around 44%. So that's good, but we still have a ways to go.
Okay. And doctors, is the level of hospitalization right now sustainable if we don't have any, real increase in vaccinations?
I think that the level of hospitalizations I would describe as an ongoing significant taxation of our healthcare system. We are still limiting elective surgical procedures that are not at higher risk of a problem if they're delayed. We still are having issues with normal throughput and efficiencies in our hospital for people that don't have COVID. We, as Dr. Weiss mentioned, we still have a lot of our regional hospitals not able to send us patients that they want to send us because we don't have capacity. So I don't think that this level of COVID volume we have now is sustainable if it continues, because we're going to have more people suffer consequences of a highly hospitalized body of COVID patients that otherwise could potentially be prevented if we had higher vaccination rates and better compliance with doing things to help us to diminish COVID transmission.
I absolutely completely agree with everything Dr. Lamentier just said. We are not in a good place. We don't want to stay here. And every time we're holding someone in our emergency room who really should be in a critical care unit, that is not the best care for that patient. And then at the same time, it's added burden to our nursing staff. So no, is it sustainable? Absolutely not. And in fact, I mean, we worry every day about our capacity to be able to take care of people, not only with COVID, but all the other people who are sick for other reasons. They're still, holding in the emergency room or holding out in those regional facilities, because we just don't have the capacity to bring them in appropriately.
Yeah, and the only thing I would add, and you guys alluded to it, but staff burnout. I mean, staff are getting fatigued. It's a lot to come in and not get a break, sometimes take care of an additional patient or two than what you would normally take care of during your shift. And so, we got to realize it is impacting our staff, and especially when you look that many of those admitted are non-vaccinated individuals that could have done something to prevent that severe of an illness. So I just want to encourage people to get vaccinated. It will help out the healthcare staff. It's going to help out for those people that are waiting for a bed, whether they're sitting in our own ERs now, or whether they're in a community hospital out throughout the Panhandle that want to come here. So don't forget, this is taxing our staff. And I'm not just talking nurses, I'm talking our entire hospital staff, from engineers, technicians, lab, is taxing them.
Okay, Dr. Bell, you've talked before about respiratory illnesses in general. Can you update us a little bit on that, and especially RSV?
Yeah, sure. So we are definitely seeing a lot of RSV. It's been going on for a couple of weeks now. I was in the covering the pediatric ward last week at one of the hospitals, and I think that I had on my last day on service, I believe I had 4 children with RSV that were in the hospital on that particular day. So we are seeing a lot of RSV. It's worth noting for folks that this is highly, highly unusual. This is sort of a snowstorm in July kind of out of season phenomenon. And the reason is that masks, frankly, are pretty effective. So everybody was wearing masks back last winter when we usually have RSV. And so it didn't really happen then. We all took our masks off as a community back in May. And then so we're dealing with the RSV now. So it is still something that's going on that is putting probably more of a strain on our pediatric hospital system, even than the COVID patients are right now. Certainly we have more RSV patients in the hospital on the pediatric side than we do COVID. But when we start looking at RSV plus COVID plus influenza, these things they all add to the overall burden or requirement of resources from a hospital standpoint. So we need to prevent those things that we can prevent, which goes back to vaccinating, getting your flu shot, wearing masks, et cetera.
Okay, thanks everybody for that information. That's it.
Thank you, Kevin. This concludes our news conference for today. I want to thank everyone who joined us on our panel. Thank you for your time and for